Hello, I'm Ed Sardella, and it's my pleasure to welcome you to the Rose Institute for Joint Replacement. Everyone at Rose wants you to have an excellent experience from your first appointment to your last follow-up visit. As the Rose mission says, foremost in our hearts and minds is the commitment to our patients. This video will help you make a safe and comfortable transition from the hospital to home and help you make a successful recovery. It reminds you about your medication, how to monitor your recovery, when to call the doctor, and about regaining your mobility. First, let's talk about your medication. You started taking medication in the hospital, especially pain medication. In the hospital, your care team teaches you to measure your pain on a scale from 0 to 10. 0 is no pain. 10 is the worst pain you can imagine. This information helps us keep you comfortable in the hospital. Learning to manage your pain when you get home is an important part of your recovery. Follow the guidelines about narcotic pain medication your hospital care team gave you. As you know, narcotic pain medications cause drowsiness. Feeling sleepy is fine when you're in the hospital, but it can be a big problem when you get home. It's very important to remember that you must never take narcotic pain medication if you're going to be driving or doing anything else that requires you to be alert. Keep an eye on your supply of pain medication, making sure you call your pharmacy at least 2 days before you run out. Pain medication helps you manage your pain. However, a common side effect is constipation. It's fine to take ordinary laxatives to help relieve constipation, such as milk of magnesia, Dulcolax, and X-Lax. However, there are some simple things you can do every day that are good lifetime habits. Drink more fluids, especially water, lots of water, and eat more fiber. Good sources of fiber include fruit, vegetables, and whole grain cereals. Your doctor might also suggest a stool softener, such as Docusate Sodium, which you can buy over the counter at your local pharmacy. A common brand name is Colace. Sometimes you need even more help. Use laxatives that have worked for you in the past. The important thing to remember is to start doing something at the first sign of constipation. The good news is that constipation usually clears up soon after you stop taking narcotic pain medication. Another medication you will start in the hospital and continue at home is an anticoagulant, a blood thinner. Anticoagulants help prevent dangerous postoperative conditions such as blood clots. The most common anticoagulants, or blood thinners, are Coumadin, Arixtra, and Levinox. Rose most often uses Coumadin. Your doctor will run blood tests when you go to your follow-up visits to see how you're doing on the anticoagulant and may change or adjust your prescription. Remember to take your anticoagulant at the same time every day and continue to take it until you're out of pills or until your doctor tells you to stop. Also, and this is very important, do not take aspirin or other anti-inflammatory, such as Motrin or Aleve, while you're taking an anticoagulant. Combining aspirin or anti-inflammatories with your prescribed anticoagulant could create bleeding complications. Because you have a higher risk of infection after joint replacement surgery, you may need antibiotics from time to time, especially when you're going to have dental work or some other surgery. By dental work, we mean cleaning, caps, and extractions. You need to make sure you ask your dentist for antibiotics in plenty of time. Remember to call at least 1 week before your appointment and ask for a prescription for the antibiotics you'll need. Check with your dentist about when to start taking the antibiotic. You will also need to take antibiotics if you're planning to have any kind of surgery. Remember to tell your surgeon if you're allergic or sensitive to any antibiotics, such as penicillin and sulfa. Now let's talk about what you should look for when you get home. You need to know what's normal and when to call the doctor. For example, it's perfectly normal to have some swelling after joint replacement. The easiest way to manage swelling is elevation and ice. To elevate your leg, lie flat, and keeping your leg straight, lift your leg and rest it on a pillow or bolster. Ideally, your foot should be higher than your knee, and your knee should be higher than your heart. Remember, if you've had a hip replacement, you need to keep your hip flexion less than 90 degrees. Elevate your leg like this several times a day, as often as possible, for at least 1 hour each time. You can apply ice to the joint or areas that's swollen any time. Bags of frozen peas or veggies or crushed ice in Ziploc bags are good because they conform to your body. They can also be refrozen so you can use them again, but you might want to mark the bags of vegetables to make sure they don't get served for dinner. Put the ice on for 20 minutes, then take it off for 20 minutes. Repeat, 20 minutes on and 20 minutes off the whole time your leg is elevated. You might want to set a kitchen timer or an alarm clock to help you keep track. Although some swelling and tenderness is normal, excessive swelling or tenderness is not. If you have unusual swelling or tenderness, calf pain, or fever, call the doctor. These may be signs of deep vein thrombosis, DVT. DVT is inflammation and clot formation in a deep vein. It is a risk with any orthopedic surgery, and it's serious. Your anticoagulant helps prevent DVT. That's why it's important for you to take your anticoagulant every day. Your anticoagulant also helps prevent another serious condition, pulmonary embolus. The common signs of pulmonary embolus are shortness of breath and/or chest pain. If you experience any of these symptoms, call your doctor. Pulmonary embolus is a blockage of an artery in the lungs and is often caused by a blood clot that might have started with DVT, deep vein thrombosis. It's easy to take care of your incision at home. Keep an eye on the drainage from the incision. It's normal for the incision drainage to be bloody at first. Over time, the drainage usually turns pink and then yellow. As long as your incision drains, keep it covered with a light dressing. Make sure to change the dressing at least once a day or more often. A daily dressing change is usually adequate. Do not take baths until you have your doctor's permission. However, you can start taking showers as soon as you have enough mobility. In fact, a daily shower will help keep your incision clean. Take the dressing off when you shower. Let the water run over the incision, but don't scrub the incision or wash it with soap. Pat dry. Your doctor will take a look at the incision drainage at your follow-up visits. But if you notice excessive or persistent drainage, or if you have to change the dressing more than 3 times a day, call the doctor. Now let's talk about what you can do to help yourself regain mobility. You started working with a physical and occupational therapist in the hospital very soon after your surgery. Their job is to help you recover and return to your normal lifestyle as safely and as independently as possible. The physical therapist will get you moving in and out of bed, sitting in a chair, walking again, and teach you new exercises every day to help you move with your new joint, put weight on your surgical leg, and walk again. Once you get home, follow the exercise plan designed for you. Your exercises are a vital part of your recovery. Exercise builds muscle strength, increases your range of motion, and releases endorphins, which are natural pain relievers, and make you feel better. Unless your physical therapist or doctor gives you different instructions, remember to do your exercises 3 times a day. Using a stationary bike is great exercise to increase the joint's range of motion and muscle strength. Adjust the seat so that when you pedal, your knees stay lower than your hips. If you've had knee replacement surgery, you can start using a stationary bike when you get home. If you've had hip replacement, walk for the first 2 months. After 2 months of walking, you can add the stationary bike to your exercise routine. The occupational therapist started working with you in the hospital too, helping you find new ways to approach the activities of daily living. We don't want you to drive for at least 1 to 6 weeks. You'll need to arrange ways to get to your follow-up appointments, the supermarket, and other places. The occupational therapist helps you learn how to use adaptive equipment when you get home. Using a reacher makes it easier to put on underwear and slacks, especially if you've had hip replacement. It also allows you to maintain your hip precautions. A sock aid helps you get your socks on your feet without having to bend. This is especially important if you've had hip replacement. Remember, you always want to keep your hip flexion less than 90 degrees. The occupational therapist can help you learn how to put on elastic stockings. and give you tips about wearing slip-on shoes and using long-handled shoe horns. When you go to bed, make yourself as comfortable as possible so you can sleep well at night. We hope we answered most of your questions. If you still have questions, please talk to anyone on your hospital care team. Everyone at the Rose Institute for Joint Replacement wishes you a safe and comfortable transition from the hospital to home and a successful recovery.